Good evening and welcome to Healthy Discoveries, brought to you by the VCU Medical Center. I'm Mandy Setliff. Tonight we discover a program that teaches physicians why it's important to get back to the basics of bedside manners.
If I'm looking down at somebody, his animal brain knows that he's in danger.
It's probably not the kind of course content you'd expect in a medical school class.
One of the easiest ways to build rapport in this situation is to match your eye line as closely as possible.
But according to these professors, interpersonal communication is critical to a successful patient experience.
There's been increasing amounts of research that shows the human element and that interpersonal communication has clinical relevance, has scientific relevance and scientific impact in terms of outcome, correct diagnosis.
So Theater VCU teamed up with the medical school to create a class that teaches doctors how to better connect with their patients.
Interpersonal communication, or warmth or empathy, are some of the terms that people use. And there's a theory that you either have it or you don't have it, that it can't be taught. But in the theater, we know these are actually skill-based things that can be taught. The chart just comes between you. The sheer act of removing the chart builds a different spatial relationship.
Because medicine today is so high-tech, Anderson maintains there's little time left to teach these interpersonal skills.
It's not that we've lost the human element, it's that we have a finite amount of time, and the technological innovations have become so very important that they take up a larger percent of our training.
Once they start experimenting with these techniques, they realize how important this is to talking to patients and how it really affects their ability to be able to care for them and be the kinds of doctors they want to be.
If you have any questions or if you'd like to suggest a topic for the show, give us a call at 1-866-828-3627. We'll see you next time. Good night.